Hello, my name is Daniel Logan, and I will be presenting on our project, Developing and Validating Methods to Automate Extraction of Veterans Affairs Surgical Quality Improvement Program Registry Variables. The Veterans Affairs Surgical Quality Improvement Program, or VASQIP for short, is a quality improvement database containing several hundred variables for veteran patients detailing various aspects of the medical record around surgical procedures which they received. For the purposes of this study, our attention has thus far been directed at the automation of variables within the VASQIP cardiac dataset, which holds 187 variables for a full cohort of all cardiac procedures within the VA. For this database, all existing variables are extracted from a patient's health record by VASQIP surgical quality nurses, or SQNs, who are assigned to fill pertinent information for all of these variables at the VA location which they are posted. This manual extraction process is timely, costly, and could result in higher rates of error and data missingness than more automated methods. For the purposes of this poster, we have provided our methods and results for the automated extraction of 10 different lab and 3 operative period variables. For the automation of these variables, the methods considered involved querying structured and semi-structured data present in other medical databases, such as the Veteran Affairs Corporate Data Warehouse, or CDW, and the Observational Medical Outcomes Partnership, or OMOP. For lab value designations, LOINC codes corresponding with lab tests were first found through a combination of literature searching, as well as referencing the CDW tables holding lab value names and descriptions prior to querying for matches with lab values. For many of these lab values, our results found that not only were the fully automated methods achieving very high congruence with the SQN entered values, it was also finding a number of values that were missing from the SQN's efforts present for those patients in other databases. These lab variables also represent a number of other variables not shown in this poster with structured data in other databases, which have high agreement with SQN designations, such as age, sex, date of birth, and date of death for patients where available. For our automatic designations on the health record during the operative period, the 3 variables selected for this abstract represent a combination of successes and challenges which we have faced automating variables concerning conditions, diagnoses, and other health statuses. For smoking status, there's been a number of challenges addressed, particularly concerning the possibility of smoking status changing prior to surgery. In addition, the variable definition allows for information received from the patient or their health record to be considered without clarity as to which is preferred. Despite this, a combination of structured smoking data from CDW as well as NLP on clinical notes have accomplished fairly high congruence with SQN designations. For preoperative and postoperative atrial fibrillation, automation utilizing diagnosis codes within the preoperative period has been fairly successful, but incorporation of diagnoses present in clinical notes using NLP has resulted in a number of positive cases disagreeing with the SQN designations. Additionally, postoperative atrial fibrillation depends upon whether or not patients have received treatment for atrial fibrillation or flutter, causing further complications with its designations. Moving forward, there are still many cardiac VASQIP variables which have not yet received automation efforts, which may benefit from methods already considered for previous variables, as well as methods not yet considered. Additionally, these attempts at automation provide an opportunity to validate the current SQN extraction methods by considering cases where automated methods disagree from SQN designations. Finally, also being considered are the best ways to implement automatic designations and how they might be used to supplement nurse extractions as already exists. Thank you all so much for listening, and I hope you have a very, very happy Holman Day.